Today we're going to talk about the eyes, about eyesight and enhancement and protection with cannabidiol. Cannabidiol has some extraordinary properties, and I want to talk to you about some of the ways that cannabidiol can help protect the eyes, as well as to preserve vision and prevent problems. And today's agenda is going to include the spectrum of eye disease, some of the disease processes as we standardly know them, endocannabinoid deficiency, which is very prominent in eye disease. We're going to talk a little bit about cannabidiol and how it specifically works in eye disease. We'll say a few words about sizes and management using cannabidiol, and then I'll answer questions. First off, in terms of the spectrum of eye disease, I'm going to be focused on those things that are controlling the eyesight. So the first and the most significant thing for impairment of vision is cataracts. Very, very common. It's complicated in terms of its origins, exactly how it's happening, but it's very common throughout the world and in the United States. Fortunately, the corrective measure is generally surgery for that. Glaucoma is another common cause of problems within the eye, where you have an increased pressure that leads to damage to the retinal cells and leading to death. There are vascular changes that occur in the eye, things that happen with either venous blood clots, or there is blockage of one of the arteries, the optic nerve artery, leading to a loss of vision in that area. And then retinopathy, and that's the real focus on what we're talking about today, where the retina is such a delicate nerve structure. You know, looking through the eyes is actually looking into the brain. This is nerve tissue. In fact, it has its own retinal barrier, just like the blood-brain barrier. It has its own specific barrier, and it has some really interesting properties about how it protects itself. The amount of disease that is associated with blindness is quite large. We've got 1 million Americans who have blindness. There's 12 million who are visually impaired. And then if we continue at the current rate of progression, we're going to have probably double the amount of impairment, maybe 24 million people who are impaired by 2030. The total cost, considering many of the things that are involved, both direct health care as well as absence from work and not being available, is about $139 million. Huge amounts. And then I've shown a map here to show where the concentrations of blindness are located in the United States. What are the causes of eye disease? Well, first off, we talk about aging. Aging is closely associated with cataract formation and macular degeneration. I'm showing an image of cataract formation, very commonly occurring. Second is glaucoma, which is a pressure buildup that is a result of a mechanical interference with the flow of the fluid within the eye back and forth between the chambers from where it is actually promoted and produced in the anterior, inside the eyeball, and then it goes into the anterior chamber where it's absorbed. Unfortunately, this gets blocked and it leads to increasing pressure. In addition, there's diabetes, as well as the major area that I want to talk about is inflammation, because inflammation is a big problem for all of these processes. And the reason I say that about inflammation is because the eye doesn't have the ability to restore itself. Once those cells are lost, then they're gone, and you lose vision and you lose visual capability as a result of that. But let's take a slight detour into the diabetes pathway to understand a little bit more about that. I talked a little bit about that in some of my other discussions, talking about kidney disease. And whenever I talk about diabetes, these are the fundamentals that go along with it. In the case of diabetes where you have elevated glucose levels, there is the formation of advanced glycemic properties, end products. These end products are inflammatory in nature, combinations of proteins and glucose molecules combined together, and it's very irritating to the cell. And as a result, they have to be removed from the bloodstream. Special receptors actually grab these and pull these in through the blood vessel walls inside the cytoplasm and inside the tissues, so that they can be attacked and removed by macrophages. In the case of other blood vessels, there's a possibility of forming atherosclerosis. But within the eye, that doesn't happen so much, as you have vascular growth or vascular damage that occurs. Either there are ruptures in the blood vessels, there can be plaques that are being laid down, but there's also the result of a growth of an increasing vascular network. Interestingly, with the eye, as a result of injury or inflammation, additional blood vessels are created and growth comes up. And those blood vessels actually cover and prevent visual acuity at the retina. The light doesn't really get to the retina, and it causes increasing damage. Now, once in the eye, particularly where an injury occurs, such as what occurs with diabetes, then there's inflammation. And that inflammation brings recruitment of other inflammatory cells. And they also produce inflammatory substances. And then that is a vicious cycle leading to this vascular damage that occurs within diabetic retinopathy. Now, there are other immune disorders of the eye. And the first up is sympathetic disease. When somebody gets an injury to one eye, it's possible that their other eye will be subject to quite a bit of disease. Now, that's an inflammatory process where the immune system within the eye structures and the brain identifies the released antigens from the damaged eye, and it identifies them as foreign protein, and it develops antibodies to attack that. And so the attack on the good eye after a single eye injury is often an immunologic process that occurs, and it can lead to the destruction of the good eye after one eye is damaged. In addition, we have immunologic diseases like uveitis that occur with rheumatoid arthritis and Crohn's disease and many different inflammatory autoimmune types of problems. The uveitis occurs as the globe. It's an inflammatory process that's there. And it makes sense in that these are, number one, autoimmune diseases, but they're also involving the eye almost in a sympathetic fashion, probably as a result of inflammatory substances that are being promoted within the whole body and leading to the involvement of the eye. In addition, there's optic nerve immune disorders, particularly with multiple sclerosis, where you have the typical lesions and the plaque formations that occur with multiple sclerosis occurring in the optic nerve. Because essentially the eye is a nerve, and it's just a very complicated nerve with special structures that are around it. If we look at the immune pathway, we're going to talk about the immune privilege of the eye. I mentioned earlier about the blood-retina barrier, similar to the blood-brain barrier. Well, that exclusivity allows the eye to be very protective against inflammation. In fact, it has 4 separate pathways for preventing inflammation from going too far within the eye, because that's going to be devastating. So as a result of the eye is one of those tissues that is immune privileged. It was thought at one time the brain was immune privileged, but that's been dispelled. In addition, the testicles are immune privileged. Now, among the other types of immune pathways, number one for the eye is the T regulator type of cells. Now, the T cells are going to control the inflammatory and the immunologic reactions, and the T cells are very important in this particular process, and they're ramped up within the eye to protect it against excessive inflammation that could lead to blindness. There are a couple different types of macrophages, and the macrophages in the eye are labeled as glial cells. And in addition, there's a specialized glial cell that is in the eye and in areas of the tissue where the blood vessels are and the supportive structures are for the retina, called a Mueller cell. And this Mueller cell handles the glutamine. You know, glutamine is a neurotransmitter, and when it's in low levels, it is not too difficult to work with. But if it builds up, it becomes inflammatory. In fact, it is highly inflammatory, and it can be a great deal of problem. So the body needs to dispose of this and degrade this. And the Mueller cell is the primary mission is to degrade the glutamine and reprocess it so that it cannot do any particular damage. In addition, there is the retinal endothelium. Now, this is the structure that holds the blood vessels, surrounds the blood vessels, and acts as the protection at the blood vessel lining. And so these blood vessels are very important, particularly with the vascular disease that we typically see with diabetes, and also with other diseases that occur as inflammatory within the cell and within the eye. Now, the endocannabinoid system has been well established as being dysfunctional in some of the eye diseases. This deficiency we're finding more and more commonly in almost all disorders when we take a hard look. There is now pretty well established a clinical deficiency of the endocannabinoid system that's working. It's very prominent in things like fibromyalgia, migraine headaches, and several other conditions. Whenever we think of a syndrome, you could be talking about a clinical endocannabinoid deficiency. Now, in the eye, it's pretty characteristic that we see very high levels of CB1 receptors, and for the most part, these are indicating a proneness towards inflammation. In addition, we're seeing increases in anandamide, the most prominent of the endocannabinoids, being high levels apparently associated with the inflammatory situation. At the same time, there are a couple other receptors that are involved that are closely associated with the endocannabinoid system. And the first one I mentioned here is the TRPV1, which is involved with the cell death. And I bring these up because it's going to play an important part in terms of how cannabidiol protects the eye from these inflammatory injuries. Now, CBD specifically within the endocannabinoid system is blocking CB1 receptors. It's blocking the TRPV inflammatory. These are also pain receptors that have a great deal to do with chronic and inflammatory pain. In addition, we've got two other receptors that are closely identified with the endocannabinoid system, where cannabidiol is playing a particularly effective role as a blocking agent, reducing the inflammation and reducing the problems that are associated in those tissues and those diseases. In another way, the cannabidiol is working as a CB2 receptor agonist. It's actually making and stimulating the CB2 receptor. And this has very positive outcomes in terms of the anti-inflammatory effects of the CB2 receptor, as well as the other actions of cannabidiol with other receptors and other systems within the body. CBD blocks the metabolism of the endocannabinoid substances, and it actually promotes its own survival and prevents its own degradation in order to maintain blood levels and tissue levels wherever it is. And further with regard to endocannabinoid system is that it stimulates the endocannabinoid system specifically. So it is helping to rebuild a unbalanced or an out of alignment endocannabinoid system to help restore the damage, what the damage has done to the system, and get it back to full functioning. Now, CBD it works as an immune modulator. It works as a neurotransmitter regulator, an immune modulator, and an endocrine modulator. It's monitoring and controlling and regulating so many of the hormones that we produce throughout our body. Specifically with regard to immune modulation, we already are it's well established that it reduces the number of macrophages, both in the total number, and it promotes their natural cell death, as well as preventing the recruitment of additional macrophages to the area and site of injury. Cannabidiol is working to reduce and control the cytokine modulation. These are these inflammatory substances that are produced by the immune cells, but it's also promoting the anti-inflammatory immune complexes, the cytokines that are being produced. So it is really working in two directions at the same time to promote a healthy environment. And I mentioned this earlier about the Mueller cells, where cannabidiol is protecting the glutamine metabolism so that it's going through the normal processing and not creating an inflammatory and a toxic situation. CBD blocks the vascular growth factor. Now, for many of the diseases in the inflammation, we talked about some of the extra blood vessels that form. Cannabidiol is blocking this particular factor that's a cytokine-like substance that is released that increases those blood vessels. Cannabidiol blocks that and has the potential for blocking the vascular growth and the proliferation that is typically seen in a number of these retinopathies, specifically for the diabetic retinopathy. Cannabidiol, it strengthens the endothelial cells. One of the big problems for diabetic retinopathy is the leakage or the stiffening of those particular cells, and then the inflammatory actions, as well as the ability of the lining cells, the endothelium, to pull in those inflammatory substances and attract inflammatory cells that are going to be migrating through. So it's strengthening those particular endothelial cells, which have a key function in a lot of these vascular phenomena that are occurring in retinopathy. Within the cell, cannabidiol is protecting, and all cells, cannabidiol is protecting against toxins and chemo agents that are damaging to that structure. It does that by protecting the cells individually against oxidative stress and the self-suicide that they can potentiate on themselves. It's very effective for ischemic injury. So that it can be used in when blood supply is limited, as in any major trauma, and prevent the damage and the self-destruction of the individual cells and preserve their function within the organ. It prevents and it blocks the autoimmune phenomena by dampening and controlling the T cell function as well as the B cell function. We mentioned the oxidative stress. And furthermore, it maintains the blood-brain or the blood-retina barrier so that toxic substances, inflammatory substances, are not leaking into the eye and creating more of an inflammatory situation that goes on. So elixinol cannabidiol comes from industrial hemp. There's no psychological effects of CBD. It won't make you high, but it restores the endocannabinoid system. It's safe, it's legal, and it's effective throughout the country. When I use cannabidiol for eye problems and eye issues, I start with a standard dose of about 15 milligrams twice a day. I adjust it early and boldly, control the symptoms. Then I'll double the doses or cut the dose in half, depending on the individual's response. Now, cannabidiol comes in several forms: capsules, tinctures, and liposomes. And there's a new product that's just come out, Respira. which is an all-purpose formulation that can be used in both topically, orally, and vaporized. A target dose for this type of problem related to a serious condition of the eye is about 60 milligrams per day. We currently don't have any eye drops that are available. Now, one of the things that I forgot to mention earlier was about the eye enhancement, eyesight enhancement. Consistently, I have people reporting with a higher resolution that they're getting with the cannabidiol on board, an improved definition of the detail that they're looking at. Not necessarily an improvement in their focus or an increase in their ability to see close up, but it has enhanced the distant vision. Also seeing some enhancement of color perception as well as increased speed of reaction and reaction times and the eye response to that. That hasn't been validated in any clinical studies at the present time. It's a little bit like looking through a old-style television screen and then looking at a 5K screen in terms of the definition that's there. Several patients have commented to me about looking for new glasses when in fact their vision has improved so that their older glasses are actually better than their current ones. Now, who should be using cannabidiol? Well, diabetics in particular are at a situation that they could use the protection that cannabidiol offers, both for eye disease as well as for the other diseases that they manifest, the vascular issues, the cardiomyopathy, the kidney disease. All those things have the potential of being and offering great protection with cannabidiol. Certainly autoimmune conditions of all kinds, as well as the brain disorders, the neurodegenerative conditions like Alzheimer's disease, Parkinson's disease, and cognitive disorders. Brain trauma, particularly effective for preventing serious damage to the brain, as well as protecting against the inflammatory problems that do occur after an accident. There is some speculation that rapid use of cannabidiol after a major injury, such as a stroke, would protect most of the brain cells from major damage in those cases. Cannabidiol should be used for protecting people with kidney disease and heart disease. It's very effective in all of those conditions. So let me go over some of the things that we've talked about with regard to eye disease, that the endocannabinoid deficiency is very common, and that we see that cannabidiol addresses all of the major disease pathways for eye diseases. So there's an extraordinary potential that's going on here. CBD is supported in preclinical studies and in practice, seeing the changes that occur with people, with their vision and their protection. There's no adverse effects, toxicity, or drug interactions. And the dosing is really quite modest when you consider. So I want to open it up for questions at this time and point out that I've got a reference folder here with a review of all the references with many of the abstracts for the papers that I reviewed in preparation for this report. I appreciate you attending and participating, and I look forward to us getting together in a future time.